Although South Africa's road to democracy was not an easy one, however to many, it was something to look forward to. The dawn of democracy in 1994 promised, amongst others, equality for all, but for some, that dream has been deferred. And the World Bank report, which puts South Africa as an unequal society in the world, attests to this. This is evident in each and every sector of society. He says if he had a medical aid, he would go to a private hospital because public hospitals are for the poor and people who are suffering.
If I had medical aid, I wouldn't come to a public hospital and I'll be healed by now.
I belong this side was that market, but unfortunately, if it wasn't that kind of a market, I'll be somewhere else.
I can choose both, but it depends whether I am working or not. But if I was working, and then I can choose maybe go for private hospital because of maybe for saving and medical aid.
As many yearn for a better life, in recent years, many households have been struggling to keep up with the price of bread. Increasing unemployment, retrenchments, uncontrollable petrol hikes, and workers struggling to get salary increments to match the current status quo.
Unfortunately, the blame always goes to our healthcare professionals, which is unfair. That is what we are calling for. Enough support to healthcare professionals, enough pay, because currently we are faced with a situation where healthcare professionals who are experienced in South Africa are being poached by the developed world.
Another reality is the difference in the working environment, with many believing that private care is better than in the public sector. This further exacerbating the belief that South Africa is a country of two, us and them.
Anyone would go for a private healthcare system in a country like South Africa because both systems are equal in terms of funding, but one system, in the case of a private healthcare, looks after only 14% of South Africans. Therefore, there are enough resources in the private healthcare.
Founder and CEO of Alchemy Health Technologies, Dr. Ntlantla Kgatlhane says, even though the status of the health system is showing inequalities, the unique design of the public sector is that it is able to handle a huge number of ordinary people.
The status of our healthcare does show the inequalities that we actually see at country level. As you ask, I will zone in onto the hospital side, but bear in mind that the hospital is just one aspect of the entire healthcare system. There is still the issue of wellness or prevention of illness. There's still care that takes place in primary health centers like clinics, like general practitioners, and of course ongoing care outside of the hospital environment.
Ntlantla Kgatlhane, SABC News, Johannesburg.